Cancer is a leading cause of death in children and teenagers. Every year, approximately 400,000 youngsters aged from birth to 19 years old are diagnosed with cancer. In high income countries where hospital services are generally accessible, more than 80% of children with cancer are cured. But in low and middle income countries, it can be as low as 15%. According to researchers, there has been an increase in cases in Nigeria blamed on delays in seeking medical help. Mortality is considerably high compared to developed countries. One of Abuja's leading doctors says this project by the Lions Metropolitan Club will bring a helping hand to one of the most vulnerable groups in society.
The hospital truly needs such support. For the volume of indigent patients that patronize us is high. The number of unknown accident victims on admission is also high. And we are also the destination of choice for patients from the correctional facilities around us. And in fact, the list is long. Honorable Minister, sir, though we have increased our hospital bed capacity from 350 to 500 in the course of 4 years, we still do not have enough beds for children with cancer. But with this gesture from Lions Club, we can now accommodate more of such patients. We also have well-trained experts in the management of cancers.
The president of the Lions Club says this center was the group's main focus for the year. He hopes the children will benefit from the services.
To further our support on oncology services here, we are hoping to receive a grant from the international office in the US to further equip this center as may be required. I want to sincerely thank the board and management of University of Abuja Teaching Hospital for their support and cooperation in the actualization of these projects. We make bold to say that we have adopted University of Abuja Teaching Hospital as our core partners, just as we have done to Federal Capital Territory School for the Visually Challenged.
The health minister says this project has addressed a major gap in providing cancer care services in the hospital.
About a month ago, the Clinton Health Access Initiative secured the funding for a system strengthening strategy to support delivery of improved pediatric cancer services in Nigerian hospitals. This pilot study is intended to support benefiting hospitals with revitalizing multidisciplinary tumor boards, implementation of a treatment navigation program, and connecting the hospitals and their healthcare professionals to relevant international partners to facilitate adoption of global best practices.
There is now improved cancer treatment in this hospital. The hope is that the success of this project can be repeated across the country. Thuraya Farouk, Arise News.